So today we are learning about the mechanism of the normal labor. Okay. So before knowing before knowing the mechanism of the normal labor, we have to understand the diameters of the pelvis. Okay. This is the pelvic inlet. There are three planes in the pelvis. One is pelvic inlet, other one is pelvic cavity, other one is pelvic outlet. Okay. In the pelvic inlet, there are three diameters. Each plane of the diameter has three diameters. Here, as you can see, this is a transverse diameter, this is the widest. Okay, this is 13 centimeter. Then comes the oblique diameter. This is 12 centimeter. This is 13. This is 12, and this is 11 centimeter. Okay, but in the outlet, it is completely opposite to that. Transverse was 13. Here, anterior posterior is 13. Oblique was 12. Here, oblique is again 12. Anterior posterior diameter is 11 centimeter, but here the transverse is 7 centimeter. So this explains the baby has to rotate and come out. In the baby's head, we have, now let us learn the diameters in the baby's head. Okay, we have two diameters. One is anterior posterior diameter, other one is the lateral diameter. Okay, this anterior posterior diameter is the widest compared to the lateral diameter. In the lateral diameter, the important diameter that we have to know is biparietal diameter. Biparietal diameter is 9.5 centimeter. In the anterior posterior diameter, we have to know different diameters. Okay, the most common presentation is vertex presentation. In that vertex presentation, this area, you are seeing this area is vertex, and this area is bounded by sub-occipito-bregmatic diameter. This is called as vertex. Okay, sub-occipito-bregmatic is 9.5 centimeter. One more diameter is occipito-frontal diameter in a slightly extended head. This is 10 to 10.5 centimeter. Okay. Now, commonly the baby is in the vertex presentation. It is completely flexed like this. It is called as universal flexion. As I told you, anything, anywhere you see, you go, you will just go and accommodate in a place where you are feeling it is free. So the baby will go and aram se sit like this. Okay, it is 13 centimeter here. It can go and aram se fit like this. Okay, the anterior posterior diameter of the head entering into the transverse diameter of the inlet of the pelvis. This is called as engagement. Okay, so this is occiput. Occiput will be anterior most of the time. Occiput posterior is less common than occiput anterior. So left occiput anterior is most common than the right occiput anterior, because left side you have sigmoid colon here. It needs a space to go here. If it is the right occiput anterior, the chin will occupy this area and will decrease this area. So left occiput anterior is most common than the right occiput anterior. Okay. So now the head is engaged in the either in the transverse diameter or less common in the oblique diameter. Okay. After the engagement, now there is descent. Descent is caused by two factors. One is the one who is pushing, that is uterus. Second is maternal efforts. Amniotic fluid pressure, they all cause dilatation of the cervix. They don't cause descent. Okay. One is the uterus which is pushing will cause the descent, and the second is maternal bearing down efforts will cause the descent. And coming to the flexion. Now the head is going here. See, can you see here? It is very difficult for the head to go in this position. So it will flex like this. It will flex like this. Who will flex it? The resistance offered by the muscle. Somebody is pushing like this. See, it's going. Naturally, it is going. It is very natural. Nobody is doing any magic there. So the uterus, the pelvic floor muscles, resistance offered by the pelvic floor muscle, and the cervix, which will be here before the muscle. They will, cervix is below here. The resistance offered by the cervix and the muscles, they cause flexion. Now, why I told you at the time why the flexion should occur. At this point, if it goes like this, the diameter of engagement is occipito-frontal. Occipito-frontal 10.5. If it flexes like this, it is suboccipito-bregmatic. So it is 9.5. It is very easy to go. Can you see here? It is very easy to go. So now after this, there comes the internal rotation. So why should it rotate?
Because the outlet is
Outlet is, yes, it is 13 centimeter. Inlet is 13 centimeter with transverse diameter. But in the outlet, anterior posterior is 13 centimeter. So it will definitely turn like this. Okay. So it has to rotate. But who will rotate? God has given a beautiful pelvis. The pelvic cavity is not, it is not like this. It is like this. Pelvic cavity is like this. Okay. So whenever there is a rule called as heart weight. Okay. So the pelvic cavity is not like this. See, entering this cavity, it is going down. It is not down. It is downwards and forwards. It is completely 90-degree in the axis. So the pelvic cavity is like this. Okay. What is Hart's rule? Whenever the baby's any presenting part is occiput or inciput, whichever touches the pelvic floor first. Whichever touches the pelvic floor first, when it contracts like this and leaves, it will come and fall. Come and rotate anteriorly. So this is Hart's rule. If it's inciput, if it touches, this will come anteriorly. This happens in case of occipito posterior position. That is a problem with occipito posterior. Or it will go to posterior position. Completely extended head, inciput touches the pelvic floor first. This will come out, yes, anteriorly. Occiput touches, it will come anteriorly. This is Hart's rule. After the internal rotation, leave. The baby was like this. Just see this hands. Where were the hands? Like this. Okay, hands were like this. Head was like this. Now it has to rotate this. We divide it into 8 quadrants. This is 4 quadrant. If we draw one more line, this is 8 quadrants. So it will. So this is 1/8 of the circle. It will rotate. 1/8 of the circle. Can you sustain in the neck? 1/8 of the circle you can turn and see like this. No, for hours together. But like this, it is difficult. So 1/8 of the circle will rotate. Shoulder won't rotate. 2/8 of the circle will rotate. Shoulder will rotate. Shoulder was in the anterior posterior diameter, or if it was in the babies, if we take it in the left oblique position, shoulder will be in the right oblique. Now the head will rotate. Here 1/8 of the circle, there is no shoulder rotation. We'll consider this much only. We don't have to complicate this. Okay. Now the head rotated internally and it came out now. It will stay like this only. It will go back like this. This is called as restitution. Okay. Here once it is coming down now, this part, the occiput part, which is touching the vulva, at one point it won't go back. Where when this part, can you see there is a occiput, there's a prominence. When this part crosses the pubic symphysis, it will come and hinge like this. This part, when it comes down, this is called as crowning. There is no recession of the fetal head back. Okay. So after that, it came out like this. It rotated back. It restituted back, not rotated. There is a, okay. Now the shoulder is in the right oblique position. Now what shoulder should do again? Which is the widest diameter in the inlet?
Inlet transverse.
Okay. Inlet is transverse. It has come down now. Okay. In the outlet now, it is just behind the pubic symphysis. Now how it should rotate? Anterior posteriorly. So the shoulder now will come and rotate anterior posteriorly. The head was like this. Previously the head got engaged like this only. Whenever it is coming out, it is like this only. So remember, whichever side the head was there, it got engaged, that side of the head will be there. Now after the shoulder rotates anterior posteriorly, head will rotate to the opposite side of the restitution of the 1/8 of the circle. And now it will come out. This is called as whatever head movement you are seeing, this is called external rotation. And now the anterior shoulder is stuck behind this pubic symphysis. In order to deliver, you have to first take out the anterior shoulder. You will pull down and take it out like this. If you take it out like this, the pubic symphysis will be here. So you have to pull it down behind the pubic symphysis and take it out. Delivery of the anterior shoulder takes first. You will be able to do that. Followed by posterior shoulder. Okay. Stop.